Did you know that pancreatic cancer ranks amongst the most lethal types of cancer, with a mere 12% 5-year survival rate? Here's what often gets overlooked. The early signs of pancreatic cancer are subtle and frequently missed until it's too late. Every year, tens of thousands of people receive this devastating diagnosis, often when the disease has already advanced significantly. According to the American Cancer Society, early detection can dramatically improve survival rates. What's particularly concerning is that many early symptoms of pancreatic cancer resemble minor, everyday ailments, making them easy to miss. In this video, I'm going to highlight 8 early warning signs of pancreatic cancer that could potentially save your life. These aren't the typical symptoms you've probably heard about, like persistent jaundice. Instead, we'll explore the unexpected and lesser-known signals your body might be giving you, well before the disease progresses to a critical stage. Far too many people dismiss these subtle signs, but catching them early can make a world of difference. This isn't about creating panic, it's about equipping you with life-saving knowledge. By the time you finish watching, you'll understand how to spot the early indicators of pancreatic cancer and take proactive steps for your health. Stay with me, because this information might be the key to protecting yourself or a loved one. Let's talk about something your body might visibly show you if something's wrong. 1. Yellowing of the skin or eyes, also known as jaundice. It might not seem like a big deal at first, but it can be one of the key early indicators of pancreatic cancer. Here's why this happens. Your pancreas is located near the bile duct, which helps bile flow into your intestines to digest fats. If a tumor starts to grow in the pancreas, it can block this duct. When that happens, bile can't flow properly and starts building up in your bloodstream. This causes bilirubin, a yellow pigment in bile, to accumulate, giving your skin and eyes that yellowish tint. Interestingly, jaundice is often one of the first signs that leads people to seek medical attention. In fact, over half of pancreatic cancer cases are diagnosed because of jaundice, according to studies. It's often associated with tumors in the head of the pancreas that block the bile duct early on. At first, the yellowing might be subtle, just a faint change in the whites of your eyes. But as it progresses, it can become more noticeable on your skin. You might also notice dark-colored urine, pale stools, or even itchy skin, all caused by the same bile buildup. These signs can be easy to overlook or dismiss as unrelated, but they shouldn't be ignored. If you see these changes, especially if you're also feeling tired or experiencing abdominal discomfort, it's important to check in with your doctor right away. The good news is, spotting jaundice early could lead to an earlier diagnosis and better treatment options. 2. Persistent upper abdominal or back pain. Another significant red flag for pancreatic cancer is ongoing pain in the upper abdomen or back. While occasional aches are normal and often harmless, the discomfort linked to pancreatic cancer tends to be quite specific. It usually begins as a deep, dull ache in the upper abdomen and can spread to the middle or lower back. Studies have identified abdominal pain, weight loss, and appetite loss as some of the most common symptoms associated with pancreatic cancer. The type and intensity of the pain can vary depending on the tumor's location. The pancreas is situated close to the spine, so as a tumor grows, it may press on nearby nerves and tissues, leading to this characteristic pain. Unlike typical muscle aches, this pain doesn't go away with rest and can feel worse after eating or lying down. If this type of pain lasts for weeks, especially if it's paired with symptoms like nausea or unexplained weight loss, it's important not to brush it off as stress or a minor issue. Consulting a doctor promptly can lead to diagnostic steps like imaging tests or blood work that might detect pancreatic changes early, offering a better chance for effective treatment. 3. New onset diabetes. A surprising and often unnoticed early sign of pancreatic cancer is the sudden onset of diabetes, especially in people who have no prior risk factors or family history of the condition. The pancreas is essential for regulating blood sugar by producing insulin. When pancreatic cancer develops, it can disrupt this balance, leading to unexpected spikes or drops in blood sugar levels. Research from the National Cancer Institute has highlighted a strong connection between the new onset diabetes and pancreatic cancer, suggesting that tumors can interfere with insulin production or contribute to increased inflammation in the body. Symptoms of diabetes triggered by pancreatic cancer may include excessive thirst, frequent urination, unexplained weight loss, or persistent fatigue. If you already have diabetes, a sudden difficulty in managing blood sugar levels, despite following prescribed treatments, could also signal an underlying issue. If you notice new or worsening diabetes symptoms, particularly in combination with abdominal pain or other unusual changes, don't ignore them. Prompt medical attention and screening could uncover pancreatic issues early, potentially making a significant difference in treatment outcomes. Next, let's talk about something that might not seem like a big deal at first, but could actually be a major warning sign. 4. Unexplained weight loss. Here, I'm not talking about the kind of weight you lose intentionally through dieting or working out. This is the kind that sneaks up on you, suddenly and without any effort on your part. Here's why this happens. Pancreatic cancer can mess with your digestive system. The pancreas produces enzymes that help your body break down food and absorb nutrients. When something goes wrong, like in pancreatic cancer, those enzymes aren't doing their job. Your body struggles to digest fat and other nutrients, leading to what's called malabsorption. What does this look like? Rapid weight loss, muscle loss, and feeling constantly tired. Studies even show that unexplained weight loss is one of the most common early signs of pancreatic cancer. It's like your body isn't getting what it needs, and it starts breaking down its own reserves. If you've noticed you've lost a significant amount of weight, let's say more than 5% of your body weight in just a few months, and you haven't changed your eating or exercise habits, don't brush it off. Pay attention to other things too, like if you're losing your appetite, feeling bloated, or noticing greasy stools. These could all be clues that your pancreas isn't working properly. And here's the deal. The earlier you catch it, the better your chances of getting effective treatment. So if this sounds like you or someone you know, don't wait. Talk to a doctor right away. It could make all the difference. 5. Digestive issues in greasy or pale stools. Digestive issues, often signaled by greasy or pale stools, are an easily overlooked early indicator of pancreatic cancer. The pancreas produces enzymes essential for breaking down fats, proteins, and carbohydrates. When a tumor obstructs the pancreatic ducts or disrupts enzyme production, the digestive process becomes impaired, leading to malabsorption. This can result in fatty stools that may appear pale, oily, or unusually hard to flush. You might also experience bloating, excessive gas, or persistent diarrhea after meals, even if your diet hasn't changed. These symptoms are often mistaken for less severe conditions like irritable bowel syndrome or general stomach discomfort, which can delay a vital diagnosis. If digestive troubles like these persist, particularly when accompanied by unexplained weight loss or abdominal pain, it's essential to consult a doctor. Early detection can lead to timely treatment and significantly improve outcomes. 6. Losing your appetite or feeling full after just a few bites. This subtle change can actually be an early sign of pancreatic cancer, and here's why. When a tumor develops in or near the pancreas, it can press against your stomach. This pressure makes you feel full or uncomfortable, even if you've eaten only a small amount. On top of that, the cancer can interfere with the hormones that regulate your appetite, leaving you uninterested in food altogether. Over time, these changes can lead to unexpected weight loss, constant fatigue, and even nutrient deficiencies. The tricky part is that most people assume it's just stress or something temporary, so they don't look into it further. But if your appetite shifts dramatically and you're also experiencing bloating, nausea, or abdominal discomfort, it's a sign to pay attention. Talking to a doctor and getting screened early could make all the difference in catching any serious issues before they progress. 7. Fatigue and general weakness. Feeling tired now and then is normal, but when fatigue lingers without any clear explanation, it could be a clue your body is trying to tell you something important. Persistent, unexplained fatigue can sometimes be an early sign of pancreatic cancer. Here's why. Pancreatic cancer can interfere with how your body processes nutrients, leaving you malnourished and potentially anemic. This leads to a noticeable drop in energy that no amount of sleep or rest seems to fix. It's not the usual tiredness from a busy day. It's a deeper sense of exhaustion and weakness that does not go away. Many people brush this off as stress, overwork, or just getting older. But if you're feeling constantly drained and it's paired with other subtle signs, like unexpected weight loss or discomfort in your abdomen, it's worth taking seriously. Don't ignore it. If this sounds familiar, schedule a checkup with your doctor. Catching issues like this early could make a significant difference in your health. 8. Nausea or vomiting. A symptom that often goes unnoticed is frequent nausea or vomiting, particularly after eating. Tumors in the pancreas can exert pressure on the stomach or digestive tract, leading to discomfort during digestion. This may cause persistent feelings of queasiness or an upset stomach that doesn't improve with usual treatments. In some instances, vomiting can happen after consuming rich or fatty foods because the pancreas struggles to produce the enzymes needed to digest them. These signs are frequently mistaken for common issues like acid reflux, food sensitivities, or mild stomach problems, which can delay a proper diagnosis. If nausea lingers and doesn't have an obvious cause, it's crucial to consult a healthcare provider. Identifying the root issue early on could uncover something more serious, like pancreatic cancer, and ensure timely treatment. Thank you for taking the time to learn about the signs and symptoms of pancreatic cancer. Remember, even the most subtle changes in your body, whether it's unexplained weight loss, persistent fatigue, or digestive issues, shouldn't be ignored. If anything we've discussed resonates with you or someone you care about, don't hesitate to seek medical advice. Early detection saves lives, and your health is worth the effort. Thanks for watching.